Good morning and welcome to a new episode of ULAT TV. I'm really happy about this topic because it is one that has been sometimes neglected in scientific conferences, and I think is one very relevant one. So today I have the pleasure to be joined by Professor Pedro Machado to discuss social determinants of health and environmental exposures in rheumatic diseases. So thank you very much for joining me today.
Thank you for the invitation to be here today.
So Professor Machado, there's an increasing understanding and interest, I think, in capturing social determinants of health and how they shape health outcomes. But do you think we're doing all right? Are we capturing them in the way we should in research and clinical practice, or can we do better with that?
Well, although we've seen some developments in the last few years, I think they are still underrepresented both in research as well as routine clinical care. So there is still a strong unmet need in terms of data collection of social determinant variables, so things like education, deprivation status, and access to care. I think there is an opportunity now to encourage the collection of this data, both in routine clinical care as, for example, as part of the electronic medical records, as well as in the research setting, observational studies, registries, but also encourage the inclusion of a more diverse population in clinical trials, a population that better represents the patients that we see in real life and the different social, educational and economic contexts where they live. So I think there is an opportunity here also for EULAR to encourage a more patient-centered and holistic approach, whereby outcomes are not only explored and explained based on biology, but also based on social context and social determinants.
Yeah, I fully agree with that, and I think that's why I'm also so happy why EULAR has opened the door to have sessions like the one we have here. And I've conducted research myself on social determinants of health in the context of lupus, and what you hear sometimes from practitioners is that why do we care about this? Because I cannot influence those factors at an individual level. So do you think this is justified, or how can we use this knowledge when doing decision making with the patient?
Well, it is true that clinicians cannot change the social context of the patient. Obviously that is very difficult to do. But understanding that context is important because there are things that we can do. Understanding things like care support, family context, potential barriers to treatment adherence, for example. Understanding those factors, and then there are small things that we can do, and even by understanding those factors, that may tailor our therapeutic choice, for example. So by asking small, simple questions in your daily practice, that will help you understand these factors better. And there are things that we can do in terms of better support from psychological support, referral to other allied health professionals that can support certain aspects of the treatment. And like I said, even in terms of choice of treatment, those indicators can help the choice of treatment. So while we cannot change the overall social context of the person, we can change small things that could potentially lead to better outcomes for the patients.
Yeah, that's really insightful. Social determinants of health is one of the topics covered in the session, but also more environmental exposures. And I think cigarette smoking is the one where most research has been conducted. I think there's quite convincing evidence linking cigarette smoking with risk of rheumatoid arthritis or worse outcomes in basically any RMD. So if we think about implementation, so how do you translate this knowledge into clinical practice when discussing lifestyle habits with your patients?
So that's a very good point. And indeed, I think the evidence is extremely robust in terms of association of smoking with worse outcomes, and as you said, triggering some of the rheumatic diseases. The same way that I would recommend colleagues to assess cardiovascular risk factors in general, smoking should be addressed. My personal approach is to directly and clearly explain to the patient the negative effects of smoking in terms not only of general health, but specifically for their rheumatic disease, and then encourage smoking cessation practices, either by referring the patient to a smoking cessation clinic if it's possible, or communicating with the GP to support these type of practices. So it's something that should be routinely done in our clinics, explore the topic, and encourage the patient to quit smoking, and then liaise with other parties, either the GP or smoking cessation clinics, if you have access to them directly, in order to promote better health habits.
Yeah, that's really insightful. Thank you so much. I mean, I'm happy we're covering this rapidly evolving and clinically really very relevant topic. So thank you for joining me today.
Thank you very much for the invitation.
And thank you everybody for joining us today, and we'll see you very soon around in ULR TV.